Throughout the ages, public health has been radically transformed and improved as the world has developed. Public health as we know it today is not the same as it once was, and hopefully will be different in the future as society takes further strides in developing practices to ensure the well-being of every person. There have been countless events and individuals that have helped shape the ever-growing field of public health. For example, Dr. Jenner and the invention of vaccinations, or Michelle Obama's Let's Move program. Some of these events and leaders are more popular to the public eye than others, yet there are a substantial number of hidden heroes that have equally impacted how we see public health today. One of those heroes is Ionia Rollin Whipper, a doctor and social reformer in the late 19th century and early 20th century. As a Black woman with quality education, she paved the way for future activists, teachers, physicians, and public health outreach workers. She was an incredible figure that had an impact on the field of healthcare, and she is well deserving of our attention and praise. Ionia was born in Beaufort, South Carolina on September 8, 1872, to Frances Ann Rollin and William James Whipper. Her mother, Frances, was an influential figure, teacher, and author. Her father, William, was a judge, trial lawyer, and famous abolitionist. Upon the end of the Reconstruction era in South Carolina, prominent white supremacist groups were gaining popularity and becoming stronger. Organizations such as the KKK and other dangerous groups drove the Whipper family to move up the coast and establish a home in Washington, D.C. Ionia completed her early education in Washington and graduated from Howard University before attending medical school. She was also a teacher in the public school system for 10 years. She was lucky enough to attend Howard Medical School, which was one of the only schools in the nation to accept women. Ionia graduated med school in 1903 as one of 4 women in her class, with a degree in obstetrics. She was one of the only African American physicians of her time, and upon graduation, she started her work as a resident physician in Alabama at the Tuskegee Institute. As her career took off, she moved back to Washington to set up a private practice that accepted only female patients. A few years later, Dr. Whipper started touring the South as an assistant medical officer for the Children's Bureau of the U.S. Department of Labor. Here, Ionia launched into her work in public health. Her goal was to provide instruction to midwives in childbirth procedures. She began teaching and empowering the workforce in the area of childbirth and maternal health, including how to sterilize instruments and create birth registries. We are lucky enough to have an account of her tour, as she kept a diary during her journey. This diary proved to be very informative as it records the startling things she observed, including prejudice from whites. Ionia moved back to her private practice and began working in the maternity ward of Freedman's Hospital. Her work here further inspired her to mentor girls in need, as she observed the hardships unwed teenagers faced. She provided special care for Black women and girls because there were no other facilities at the time that served colored women. Her service eventually led her to the formation of the Ionia R. Whipper Home for Unwed Mothers, a maternity home in Washington, D.C. for Black women. The home was extremely inclusive and paid no attention to race or religion, and still exists today as a place for women to achieve self-sufficiency and to provide security for their children. Ionia spent the last few years of her life with family in Saratoga Springs, New York. She died in Harlem Hospital on April 13, 1954. Ionia Rollin Whipper was an important American obstetrician, advocate, teacher, and leader. She provided education to young mothers in need, improved and empowered the midwife workforce in the early 1900s, and selflessly aided minority groups through her medical service. She was a compassionate mentor who saw a need for change and used her skills to shape the public health workforce as we know it today.